Well, throughout the pandemic now, millions of tests have been conducted, many of them funneling through the state's public health lab. Tonight, News 19 is getting an inside look at that lab and its efforts to test for variants of concern. Here's Kaylin Hagwood.
After you take your COVID test, what's collected comes to a place like this, the state's public health lab. News 19 got an inside look as things wrapped up for the day, sitting down with the scientists behind South Carolina's COVID response, including Dr. Nicholas A. Pierre.
I am the State Public Health Lab Director. We are a level 3 lab where we test for agents of bioterrorism, chemical threats, influenza. We don't have an alternative to not performing the work that we do.
A few floors up, a random sampling of positive COVID tests are being sequenced to check for variants of concern like Omicron or Delta. Dr. Brandon Traxler, the state's public health director, is among those reviewing the data.
When these sequencers produce the results from that specimen that they have been looking at, then those results, that actual genetic code, goes to our epidemiologists, and those folks do the data analysis.
Right now, the majority of cases are of the more easily transmissible Omicron strain.
We are constantly analyzing all of these specimens to see if a new pattern emerges that may end up being a new variant.
Even when staffing is short. Greg Goodwin is one of the scientists here.
I have a limited staff, but I get help from everybody, and I mean, that's pretty much how the whole lab works now because COVID is an all hands on deck type thing.
An ongoing process the team here says they're committed to assisting with.
The public health lab here remains the people's lab.
Kaylin Hagwood, News 19, WLTX.